Welcome, everybody, to Dr. Sellers Educate. Welcome, welcome. Glad you all are here. We're going to give our colleagues a few moments to join. If you haven't put questions out to the poll yet, there is a link that you can access, and I'll go ahead and put that in the chat. But feel free to ask any questions that you have. This is a time for you all to bring your questions to us, and we will do our best to answer them. And if we don't know the answer, we will find out for you and get back to you. So go ahead and put any questions that you have in the chat. And if there are no questions coming through the chat, what I'll do is I'll go ahead and answer some questions that have come up recently. And then if there are others that join that have questions, we can address those questions as well. So welcome, everybody. Glad that you're here. How is everyone doing on this Friday, midday? I know with the different time zones, it could be morning, it could be afternoon, because we do have some international nurse educator colleagues that join us as well. So welcome wherever you're calling from. We are glad that you're here, and we're going to be talking about some of the questions that have come up. If we don't see any in the chat, we will go through the questions that we have seen come through either from our boot camp topics. Our monthly boot camp happens every single month, and that is posted out on our website, drsellerseducate.com, if you're not familiar with our website. And we have our next one on tomorrow. Okay, so very timely. What you want to do is when you show up for any of our snapshots, which are posted right here on our YouTube channel every single week, you want to make sure that you bring your study worksheet. The reason why that's so important is that it helps make sure that you are staying focused as you move forward on your journey towards certification. Now, some of you may be showing up and not on the journey to certification, and that's fine too. Our mission here at Dr. Sellers Educate is to support every single nurse educator to achieve certification or to maintain certification, okay? Or perhaps you're just here because you want to become a better nurse educator, and that's great as well. So make sure that you are printing out that study worksheet every single time you show up for a snapshot that's released every single week. The second reminder we have is to make sure that you also bring your Billings and Halstead Teaching and Nursing. That is the primary textbook that we use to ensure that we are not only aligning with the blueprint, but that we're also aligning with Billings and Halstead textbook. That's the primary resource that we use to make sure that you are looking at the material for yourself firsthand and that you know exactly where you can find the information that you need. All right, so I'm not seeing any questions come through the chat yet. So let's go ahead and address some of the questions that we have seen come up previously in our boot camp. All right, so first is related to exam analysis. So we see that quite a bit, that's a muddy point for so many nurse educators. So what is it that you need to know when it comes to exam analysis? Where there are really four different components that you want to consider when you think about exam analysis. The first thing you want to consider is making sure that you have done a really good job mapping it to the blueprint. So every single exam, the first step to ensure that we have a valid and reliable exam is by creating an exam blueprint. Okay, I think that NLM really role models that because they have a detailed exam blueprint that is accessible to all of us in the candidate handbook. So if you haven't printed that out yet, that's step number one on your journey towards certification is printing out that candidate handbook on the NLN website. You can find that at nln.org. Every single handbook, whether you're taking the CNE, the CNE novice, or the CNE clinical, has its own dedicated candidate handbook. Okay, so in that handbook, you're going to find the detailed test blueprint. It is going to include all 8 competencies if you're on the journey to CNE or CNE novice, and there are 6 competencies for CNE clinical. All right, and then the next step is making sure when you are wanting to ensure that you're closing your knowledge gaps on your journey towards achieving competency under exam analysis is to make sure that you are looking at your statistical report of how your students have performed. Now, there are 2 elements you want to consider. First is the overall exam. How well did students perform on the exam? remembering that the goal when we look at exam analysis is to make sure that we have developed a valid and reliable exam. And if students did not perform well, remember that it is just telling us a story when we look at the statistical analysis. So the story could be that students are struggling with a specific competency or skill, and the exam analysis is going to give us that data. So just remember that first and foremost, the exam analysis is really telling us a story, and we want to make sure that the story that we're being told, that hopefully there are no surprises. If there are surprises, then what you want to consider is looking at that detailed test blueprint or the exam blueprint, making sure the mapping has been done appropriately, and then considering whether or not you need to, first of all, include additional content in your lecture. Second of all, to increase the active learning strategies. As adult learners, we know that we usually learn either visually, auditorily, or kinesthetically. And then what you want to think about is if the textbook really has the most current information. So, how well is it aligned with the clinical practices that students are experiencing every single day? All right, so again, you want to first of all, key steps in the process of exam analysis and making sure that you're closing your knowledge gaps. Number one is to develop that exam blueprint, right? And we want to map it back to the assignments and the textbooks that we have required in the course. Number two is to look at that exam analysis report. So, what does the data tell you? Remembering that it's really just a story that the exam analysis is telling us about our students, whether or not they perform well on the exam, whether or not we can validate that it is a reliable exam. And what we want to focus on is, are students competent and knowledgeable about the content that we have included on the exam? And if they're not, then we have an opportunity during the exam review to reinforce some of the content, or perhaps add an additional lecture or an additional assignment to the course so that students can close the loop on specific content areas. Our goal ultimately is not only that students perform well on the exam, because we want that to happen also, but also that students are knowledgeable about the content so they can apply and analyze that content, or analyze and apply those nursing practices when they get to the bedside. Okay, so number one is that exam blueprint. Number two is looking at the report. And then number three is completing that exam review. This is going to help close the loop with our students that may struggle in a specific content area. And there can be a lot of reasons why students are struggling. That exam review is going to allow us to engage with our students in a way that they are able to ask us questions. And we do realize that sometimes the exam review can get derailed. And so we want to be clear about the expectations we're sharing with our students, that it is a time for them to ask us questions, to clarify concepts, and not an opportunity for them to debate as to why a different answer should have been chosen in that question than the one we say is correct. Okay, so remember that that exam review really is a time for us to connect with our students and to help them comprehend concepts that may be a little muddy for them. All right, so those are the three steps to consider when you're thinking about the exam analysis and how do you close your knowledge gaps. And then the second element really is tied to the data that's on the report. Okay, so if that's a muddy point for you, if you want to put it in the chat, if there's a specific component related to the exam analysis report that's a muddy point for you, I can definitely go over that. And if there isn't a specific muddy point, then I'm just going to talk about one and hopefully it will resonate. And if not, you can definitely reach out and ask any clarifying question that you have. All right, so first, let's talk about reliability of an exam question. When we write our exams, we know we've done the mapping, right? Because we are going to take that first critical step to ensure that we have developed a valid and reliable exam. So first is looking at that exam blueprint, looking at the leveling. And what we mean by that, there are two components of leveling that you want to consider. First is, what is the level of my students? The questions I'm going to include on an exam for a first semester student versus a fourth semester student should look different. Now, we know we should include mid-level and even higher level when we think about Bloom's taxonomy type of exam questions. But what we want to do is consider the percentage of questions that we are including at the different levels using Bloom's taxonomy on each of the exams. Okay, so that's one component of leveling. The second component of leveling that you want to consider is what we call scaffolding. So, how have we established that solid foundation with our students? And then, how have we built up that content over time in a way that they can comprehend those concepts? A good example is when we think about scaffolding as it relates to the cardiac system. So, with our students, we want them to, first of all, in semester one, understand why taking a blood pressure is so important, why we're checking a heart rate, why we want to listen to the heart rate, listen to the heart sounds, right? So, that's step number one, those foundational concepts is taking a blood pressure, taking a heart rate, taking all the vital signs. And then we want students to understand the blood flow. Okay, so they've listened to the heart sounds. Now, what actually happens in the heart whenever we are listening for that systolic blood pressure, that diastolic blood pressure? What's actually happening when we hear that heartbeat? And what is it that we're listening to that creates the heartbeat? All right, so that's some of that foundational information. And then we build on that. So the next step is helping students understand what happens in the heart when there's a blockage. What happens when the patient has a heart attack or a myocardial infarction? So that's scaffolding or building on previously learned information with our students. Now, think about it. If our students do not understand blood flow through the heart, if they don't understand electrical conduction that happens in the heart, it's going to be really challenging for them to fully comprehend heart failure and what key nursing practices are critical when we think about care of the heart failure patient, right? That's going to be a struggle for them. So when we talk about scaffolding, that's what we mean by that. All right, and then the next component that we want to talk about or go back to talking about is the reliability. Okay, so we have already looked at leveling. We've looked at including that component in our exam blueprint. Now let's see, based on the question we've developed, how reliable were those questions on the exam? And let's stay with the scenario that we're talking about. So a student is taking care of a heart failure patient and they've checked the vital signs and now they're ready and they've listened to the heart sounds, the lung sounds, and now they're ready to give medications. Well, let's just say they're going to give, as an example, furosemide. What are some of those key elements that the students should consider whenever they're given furosemide or Lasix? All right, so think about that. I'll give you a second to kind of jot that down, and I'm going to go ahead and pull up Bloom's taxonomy, and we'll talk through that as well. So write down, what is it that we want the student to consider when it comes to giving furosemide for a heart failure patient? What you want to think about is, what are those thought-provoking questions that I'm going to have in the conversation with the student before they actually go into the patient's room? Okay, so what are some of those key elements that I want to make sure the student is preparing for before they even go in the room? And then what type of lab work do I want to make sure I go over with that student in the clinical setting? Okay, or even in the classroom setting. This can certainly be an unfolding case study, or it could be a discussion. It could even be a debate, which is one of my favorites, that we could have with our students in the classroom. All right, so that's what you want to think about. And then as you're writing down and reflecting kind of on your thoughts and maybe even what you're doing right now with your students, it would be thinking about, what are those Socratic questions that I want to ask the students, okay? Because the Socratic questioning style allows us to ask an open-ended question for students to really process how they're going to answer the question or what actions they're going to take before they deliver that care. Okay, so I'll give you a few moments to write down some key elements that you want to make sure you focus on, and then we'll take a look at Bloom's taxonomy wheel. All All right, so hopefully you're gathering your thoughts and writing down, hopefully on that study worksheet, um, what are some what are some key steps when you think about your interaction with the student that you're going to take to make sure that they are well prepared to take care of that heart failure patient. How are you going to stimulate thought with that student and ultimately engage them in the learning process even before they enter the room? So, what is that going to look like? All right. So as you wrap up, writing down your thoughts, I'm going to go ahead and share the Bloom's taxonomy. I like to share this specific example because, and it is from Vanderbilt. What I really like about it is it gives us a good picture of not only the levels of Bloom's, but also definition and verbs associated with each level, which is really important. All right, so let's go ahead and pull up Bloom's. And if you all want to put in the chat what were some specific thoughts that came to mind, that would be great too. All right, so if you want to put in the chat what thoughts came to mind as you were reflecting on your experiences, even if you're not in the clinical setting, what are some of those key conversations that you want to have with your student as you prepare them to go into the room to care for the heart failure patient? All right. And if nothing comes to mind, it looks like it may be reversed for you for the Bloom's taxonomy wheel. So it may be a little hard to read, but let's go ahead and talk about it. So Bloom's taxonomy, I'm just going to close it out because I know it's hard to read. So for those of you that don't have it in front of you, that's okay. I'm going to kind of talk through it. And then if you have any questions, I'm going to start the poll for you to post your questions. All right, so you should be able to post any question that you have, just like in a discussion forum or thoughts for the instructor or questions for the instructor. You should be able to post your question right here in the chat. All right, so let's go back to Bloom's taxonomy. When you look at Bloom's taxonomy, there are a couple of elements that you want to consider. Okay, so first of all, in preparation for developing our lesson plan with our students, we want to be really clear about what is it that we're expecting to achieve. Okay, so what is our learning objective? Is it learner-centered? And I like to start out writing my objectives by stating the learner will. Okay, and you want to make sure, second of all, that we include a specific verb associated with that level on Bloom's taxonomy. Again, this is the Vanderbilt model, and we will put it right here in the description so you'll be able to access it and review it. But it's an excellent model if you haven't seen it before, to make sure that you are following along at each level for your exam questions and even for the assignments that we are developing for the interactions that we're having with our students in the classroom, developing these experiences, these learning experiences that are really going to scaffold students' learning, build on prior knowledge, and integrate some of the Socratic questioning format. That's really going to help students connect with the content. Okay, so even though I know it's hard for you all to see the Bloom's taxonomy framework that is developed by Vanderbilt, we're going to talk about it anyway. All right, so that first lowest level is going to be, let me see if I can open it again for you. Let's see, looks like it's not going to let me open it for you, but that's okay. What we're going to do is just kind of talk through it. And then if you all have questions about it, you can definitely let me know after our session today. All right, so let's go ahead and take a look at it. So first is going to be that lowest level, which is remembering, which is defined as recalling facts and basic concepts, define, duplicate, list, memorize, repeat, and state. Okay, so these are the actual verbs that you can use to write your learning objective. Okay, so how cool is that? That's what I like about this model, is that you're really able to not only help you see a visual of how they layer on top of each other, but you also have the verbs right here listed out that you can pull from each of the levels and use them in your learning objectives, but also even in your assignments. That's a great way to ensure that we are meeting our learning objectives, is just to go ahead and, as we're mapping out our assignments, which we should do that too, just go ahead and put in those verbs associated with some of the information that we're sharing with our students. Okay. A good basic example is when we think about defining, we want students to be able to define and to list those normal ranges of vital signs, right? That's a really important foundational expectation. We know that when students understand the importance of the ranges of vital signs, then they are then able to make critical clinical decisions about whether or not to hold metoprolol, as an example, or if they should consult the provider if they're given furosemide and the patient has had a large output, or they have had changes in their x-ray. Perhaps they have more fluid buildup on the x-ray and they haven't increased their Lasix dose, or they've had a low urinary output, or they could have had a high urinary output and they don't have IV fluids and they have not been taking in a lot of PO fluids. So there are lots of different trajectories that we can take when we think about unfolding case studies and making sure that students fully comprehend the concepts that we're intending them to whenever we're talking about our learning objectives, the scaffolding, the leveling, as well as the assignments that we're integrating into the student's experience in the classroom every single time we are writing out our lesson plans. All right, so that's what you want to know as it relates to Bloom's taxonomy, are going to be this model by Vanderbilt shows the 6 different levels. You have here the definition of that level, as well as some specific verbs associated with the level. Okay, so if this is, like I said, a little hard for you to read, it may be flipped for you. That's okay. It's right here in the description. The link is so that you can access it. All right. Well, I don't see any more questions. So we're going to go ahead and end our office hours for today on this Friday. Give me some feedback if this was helpful for you, or if there's another time that you would like for this live office hours to happen. We are here to support you on your journey. Okay. And remember, we have a no judgment zone. Our mission is simple, and it is to help every single nurse educator achieve success on the CNE exam. I hope each of you have a wonderful weekend, and we will see you next time. Have a great day, everybody. Bye-bye.